joined into a dope public health podcast. I'm your host, Demonte. And as always, this is a great space where we lead with grace and we're always open to learning. And today, I'm joined by another dope guest. I'm joined by Alexandria Kohn. Alexandria, how are you? How are you doing?
Doing pretty well. Feel definitely rejuvenated with the sun, with just time to go on walks. So I think right now I am feeling pretty good.
That's what's up. That's what's up. And welcome to the show. So, we've been trying to make this connection happen as far as recording this episode, but I feel like everything happens in perfect timing. I know you have a strong public health background, and I know we're currently kind of collaborating a few different things through the city to try to do our best to make the city a better place. So we'll kind of just dive in. My initial question is just what happened that boom, I want to go into public health. That's my thing. That's my jam. That's what I want to pursue. How did that come about for you?
Yeah, so I was in college at Beloit College in Beloit, and like any freshman, there were so many possibilities of what to be, what are the jobs, things like that. And first, I took a couple anthropology classes, and I was like, I like people, I like the study of culture and the study of communities. So originally, I declared as an anthropology major. And then there's a class by Ron Watson about it was a very over basic overlay on public health, and it was my first public health class, and I took it, and there were some concepts in there that were really not necessarily eye opening, because I think there are things I've always seen in my life, but now there's context to it. And there's hey, this isn't just because people are unhealthy or people make bad decisions. There's a lot that environment plays in with people's livelihood and health. And that was oh my God, this is, and I think also I'm a very empathetic person, and I was I want to change this. And I think one video that we watched was about Black maternal health and how Black women are dying at a higher rate than white women when it comes to childbirth. Even if you have a white woman with an eighth grade education, she has a higher likelihood of having a successful birth than a Black woman with a graduate degree. And that was well, why? Right. And I think public health gave me that avenue to keep asking why. Because I've been told by my employers, I ask a lot of questions, because I think once you start asking why, you can ask it 200 times and then it's actually going to get to the root cause. After that class, I was no, I want to do this. I want to help communities. I want to change environments. Both my parents work in the medical field, and I knew those are very high stakes. I don't think I could, in an
Okay.
emergency, save someone, but I like the idea of hopefully saving whole communities by allowing people to live in environments that really cater to them and their health needs. So really it was Ron Watson's class, and I was this is what I want to do for the rest of my life, and I haven't left since.
Oh, that's pretty cool. And one of the things I think that aha moment for me was when I was first introduced into the social determinants of health. It was for me the aha moment was I've been looking for the words, but I couldn't find the words to talk about it's not just this, it's also this. Talk to me about how just the social determinants of health are just well, first what they are from your perspective, because there's a general definition, but I feel like working in black and brown communities, that definition sometimes changes. So just interested in your perspective on that definition and with your expertise and kind of how you see that showing up in our community here in Milwaukee.
The way I like to explain social determinants of health is every factor that influences how one health is, right? Whether that's positive or negative, it's all those factors. So when you think about your environment, how close is your nearest grocery store? What do the sidewalks look like? Is there lighting in your streets? Do you feel safe to go out at night? That's a factor that plays into someone's health, whether they're able to go out on walks, whether they're able to have access to healthy food. When we're thinking about other socials like transportation, do you even have a bus line that can take you to the park, to work? We can think about just even the individual context. Who are you as a person, right? We're thinking about people of color and minority communities. Like, what does that historical racism play into someone's health? As we know, it does. The epigenetics of someone, right, like carries with you. And that's why we do see a higher rate of high blood pressure, diabetes, all these other factors. So I think of social determinants of health. I really think about what plays into everyone's health. And I think it's everything. I think everything anyone does, every environment that anyone lives in, influences your health. Policies, rules, anything, whether or not you have family in the household, whether or not you have even animals, right? So I like to look at social determinants of health as really what plays into whether or not I can make a decision on my health, whether that's positive or negative, and if I can't even at all due to where I live or just the things that I have access to. Every class they talk about it, and I think it is a buzzword, right? And then when we
Mhm.
really talk about it, it is interesting to be like, well, when I say that, what do I really mean? I think I just mean everything, really.
Yeah.
Social
Yeah, and
determinants.
I think, and to me, what you're doing, it just normalizes it for like the everyday person. Like one of the things that we're talking about a little bit earlier, just before we press record, like, well, what about the average person? It's like, okay, I don't like some of the things that are happening in my neighborhood. We never get, we've been requesting two garbage cans, but we have to pay for another one, but I can't afford it. But we want to keep our alleys clean. It's like people that are just like, I care, I want to be involved, but I don't have this education or this background. How can folks that just are in the community that they care and they want to be involved, how can they actually participate in trying to just make our community better from that public health standpoint?
Mhm. I think one thing I tell people is really just building community amongst your neighbors, whether that's talking to your downstairs neighbor or the neighbor next door. I think it just helps being able to have connections with one another. That is public health. Human connection, social connection is public health. And I think once you're able to start talking about some of these issues, right, when you bring people into that conversation, people are so creative in finding solutions. Like my solution in my head might be 10 times different than your solution. And so I really think starting at like that social connection piece, and I really think that enhances safety of communities too. One thing I was talking to a couple of people, and I think we hear this narrative a lot in Milwaukee, like, oh, you don't want to live on this side of town. We know what they're talking about, right? We know the
Mm-hmm.
underlying racism that comes with that conversation. And my feedback always to them is like, you feel safer in a community that you're involved with, right? When you know your neighbors, when you know who's living next door to you, when you share, conversations, even if it's about, hey, I need two trash cans. Do you know where I can get one, right? Now I know you're my neighbor and I know you see me as a person. And so I think public health is everything that we do. I think everyone is a public health expert, right? Like we've all had conversations about health, we've all had conversations about the safety. So that's like my very basic answer. But now working in government, I did not know how important like alders are, right? Like if you really want to see that community change and that hyper local change, you have to talk to your alders. Some of them are not very transparent. Some of them are not
Mm-hmm.
very social in terms of getting back to their constituents. But I think when enough voices start talking, they have to answer eventually. And so that's when the social connection piece comes in, is really pushing your alders to make the changes in the community that you need. I think since working in government, it's a lot easier said than done. I think there's a lot of stonewalling, there's a lot of barriers, but I really believe that it's the voices that count and the masses of the voices. So, step one, talk to your neighbors, have those neighbors talk to their neighbors, and
Yeah.
then you're going to get the whole neighborhood. And what kind of change can all those voices do?
Yeah, that's pretty powerful because it really just really shows people just the impact of that voice and then the different ways to utilize it, whether that be going to a poll or calling their older person to gather some information or to just share a concern. What are some current public health strategies that are like currently underway in the city of Milwaukee that like folks may not know of? I love to ask this question for every person that I connect with that's in Milwaukee because when you log on social media, sometimes there's a narrative that nobody cares, nothing's being done, nobody's working towards anything, and people that are in your vantage point that know initiatives. I love just for you to be able to speak to, like, well, these are things that are currently underway that folks are working on.
Hmm. I think one thing about public health is I truly think that people who work in public health are hidden heroes because we could never estimate how many lives we save, right? Or like what are our true health outcomes. There was a book, and I'm probably quoting it wrong, but it was like public health, I think, saves over like 300,000 lives like once a month, or I'll have to find you the exact quote.
Yeah, yeah.
I think that is something that we really stress. I think if you're wanting to know specifically what the city is doing, I would go to mkelevate.gov. There's our community health improvement plan. There's over 107 strategies that our community is working on for the next 5 years to influence the health of the city of Milwaukee. And there's a lot of really great initiatives to get in touch with there. A couple that I'm working on specifically is one is being able to educate for a guaranteed income programming or funding. So what that is like people get a set amount of money each month. It's unrestricted. I don't care what you do with it. Studies have shown that people have used it to buy food, to go back to school, to get clothes for their kids. Like a lot of the data is showing that this initiative is helping people survive. We know it is expensive to live out there, so we're hoping to educate people to hopefully be able to, when we see anti-GI bills starting coming up at the state, that we can have people to be like, no, we need this in our community. Right now, Iowa, there's legislation that's going to ban all guaranteed income programs currently. And it is moving
Wow.
through. Yes, it is like probably there's a good percentage of chance that it will get passed. They're like, it's a communist policy. We don't want guaranteed income, but people need it. So working on that. Another specific one that I'm working on is I am coordinating a harm reduction subcommittee. If anybody would like to get involved, please reach out. So, what we're doing currently is we're doing a landscape of all the safer smoking harm reduction supplies there are out there. We know that we have a lot of needle exchanges. We have a lot of really great organizations giving out clean needles, fentanyl testing strips, things and education for people to inject safely, but not smoke. When you look at the demographics of who's injecting and who is smoking, a lot of our white community members are using the injection method versus a lot of our community members of color are using the smoking method. But we're not handing out any safer smoking items. And people are like, well, why do you? You know, when pipes get hot and you're smoking, you crack your lips, that's bleeding. I could pass on Hep C, I can pass on HIV, but we're not giving those out, and we know our community needs those. So right now, I'm working with a really great community members. Probably, I think there's 16 organizations on the committee, and we're hopefully going to write a city ordinance that would drop all drug paraphernalia fines down to $1, mimicking what Madison and Dane County did. And I think that would really help encourage people to want to carry safer smoking supplies to hand out. So if you're wanting to get involved, I would love for anyone. I think it's really important for communities to lead this effort because I'm not the expert. Our community members are the experts. I'm just here to help push it along.
Yeah, and those are both two really important ones. And I think what I like about them both is that they kind of address a lot of elephants in the room. It's like, studies show that complete abstinence of anything is just not a high success rate. So, knowing that this is going to happen, here are some ways to eliminate. I just love how that's like, it's just a very practical approach to going about things. And then just a general income. What I like about that is it also just allows people to that are unable to do certain things because of health reasons, but I don't have social security, or it's actually mental health, but I can't even afford to go to a therapist, but I can't hold down the job. So those different things. Is there anything your research that you've seen, like how those things just positively impact the community? Like you're saying, it'll reduce Hep C and things like that. But like as far as like general income, is there anything else that like you've seen that really is helpful and positive from that?
Yeah, I think one thing I've learned in this position is you have to talk money. I think that's the only time people listen is when you're like, hey, how can this benefit the economy? How can this benefit your tax dollars, right? And I think the studies have shown the economic enhancement of the GIs, right? So, like when you're giving people money, they spend it into the communities. They go to the store, they go to all these other different entities they might have not visited before. All of that is taxable, right? When it's going into somebody else's business. And that's coming back to our community. And so I think one benefit is we really do see an increase in just overall economics for those cities who have piloted a guaranteed income. And I also think you bring up a really good point about like people can use this for things that are needed that they just haven't been able to afford, like mental health. My therapy bill is $150 a week. That is a lot of money, right? And I am someone who I'm so thankful to have the income to be able to spend it, but it hurts. That 150 hurts. And that is a barrier for so many people. And if people are able to get money to go to therapy finally, to get medication they might have been putting off, what diabetes medications like crazily expensive. And these guaranteed income programs have shown like 9 times out of 10 people are using them for things that they truly need. There's a lot of argument of like people are just going to buy drugs. Like we love like for people who don't make a lot of money, we love to pressure them into like what you need to buy. We've seen that with Snap Money. We've seen that we're like, hey, you can't afford this, but we're going to tell you you can only buy this. And it's almost like we feel like we have to like micromanage people's money as if they're not adults, can't make those informed decisions. So I'm really hoping, I know that right now there's a guaranteed income program in the city of Milwaukee helping pregnant women in certain zip codes. And I'm really excited to see what the data shows from that, from the Silver Family Foundation.
Yeah, that's really, really helpful just because it just sheds light on, hey, these are some things that are currently happening in our city that you may not know about, but there is a movement. Can you also talk about like, the other one of the things is like, well, there's this issue of trust between community and then people that are service providers, that seats that both you and I sit in. What can you say about things that have been done to maybe bridge that apprehension, for like, okay, well, you're saying that this is helpful, you're coming to my community offering these things, but like, how are we building trust with our community?
So I working with the city and specifically the health department, we had built mistrust for years and years and years, right? We've never had a stretch of time where it was rooted in trust in the community. And I think that's one thing we are now on that flip end working on is what does trust look like? And I think it starts with power sharing. We cannot hold the power. I can't host every single meeting with me as like the powerful person in charge setting the agenda. So I think we are doing a lot of work with power sharing and what that looks like authentically with community members. We are asking community, what does it look like to share power? How would you like us to share power? How would you like us to share resources? And so I think, like I said earlier, it's really viewing community as the true experts and that we are your servants. A lot of times I follow up my email with some organizations like, hey, I work for you. I work for the city, which means I work for you and whatever that looks like. And so I think it's also showing up for partners. I think a lot of times we do a lot of asking, right? Can you show up to this? Can you come do this? Do you need me to set up some tents? Do you need me to put flyers around town? Like, how can I help your organization succeed? I think we are slowly, right? Like, I think trust takes years and years, and we are the community health improvement plan. I think we're on year 2. We still have 10 more years of trust building and 2 more cycles of the community health improvement plan. And, like you're on our steering committee that is led by community. So I really think it's like no longer just keeping everything within the health department itself, but like how do we truly express a public health 3.0 model where we are not seen as a true experts, but community is, and how do we support community? And I guess like what that looks like in action is just showing up. It really is. Something as simple as just showing up.
Yeah, and I think for me, the coolest thing is like it's one thing to read that in a book and talk about or in a report, but kind of seeing it in real time just goes a long way because like you said, now there are real lives being impacted. One of the things that's been helpful for me is like also seeing folks that like yourself and others on the steering committee and then seeing like former colleagues now working for the county and then even friends from back in the day like, oh, you work for the county as well. So what I'm just seeing from my vantage point is I see more people that have always been talking about the community for as long as I can remember start to actually be in positions to serve the community. So that piece has been very helpful just for me to see. And I just wanted to just share that here just so folks can see, like, you know what? It might be somebody that you went to school with that you've always heard talking about this and that. Now they're working for the county doing these different things. So, I find that's very impactful. And then you guys are also in the communities. Can you talk about like that seems also to be very intentional?
Yes, and it's really coming from our supervisor, Marcus. So he has been super intentional with making sure that we are out in community. We, as a public health strategist, we have a very unique job where I don't directly do direct services. If I if I did not want to get in touch with community, I wouldn't have to. I could sit at a desk and do research all day. But our supervisor and all of us are like, that's not what we want to do. We want to be out in the community. We really are servants, right? So like I want to be in community meetings like, hey, do you need me to help facilitate strategic planning? Do you need me to help you write a grant? Like what do you need help with? And they're not going to respond if it's just me in an office sending emails out, right? And so, how are we actually showing up to people's spaces and being involved in their work? So, it's really, I think, Marcus and then my team is trying to be really intentional with what spaces are we in, how do we create that trust so we keep getting invited back to those spaces. So yeah, and that's really kind of taken flight, I would say, this past year, as being really intentional with just showing up in whatever capacity.
And that's just I find that to just be that's also something that's you can see and you can say, well, the presence is there. It's not like you said, folks are not just sitting behind a desk. You're actually out doing the work. Anything else you can say about the community health improvement plan that maybe folks don't as included on there that, maybe some rumblings you've heard around the city?
Yeah, I think so. When you're thinking about community health improvement plan, I don't think a lot of people know what it is or that it even exists. And so, specifically, so for per state statute, every health department has to go through this process every 5 years where we collect data. So, we asked community members, we did a survey and we had over 2,000 respondents, and it was from a lot of different demographics. I think a lot of times you do a survey and it's white to middle age women who are able to do those surveys. But this survey, we had a lot of responses back from community members and diverse community members. So we did the survey, we did a photo voice submission. So people were able to take photos of where they saw Milwaukee thriving in health and then where they saw where there needs to be improvement. Close to 90 submissions. We took some other data, secondary data from different sources. And so from there, we came up from our priorities, which are truly community informed. Community told us they want to see us tackle racism and health equity as a community. They said they wanted us to tackle maternal and child health, so our health of our birthing people and their babies. They said they want us to look at built environment. So really the environment where we work, play, live, everything, which includes the reckless driving that we're seeing in our community and includes the the deterioration of a lot of our rental properties and the lead abatements. And then they said our last one is safe and supportive communities. And so, really, like, what does community wellness look like, and how do our community members feel safe? Those are the priorities we're working on for the next 5 years. There's some really great initiatives that I think people can get involved with each priority. So if you're like, hey, I'm really interested in maternal and child health, you can go to our website or you can come to our action team meetings. We host these quarterly meetings, which are open to community members. And also, if you're not attending on your work time, we do pay you for your time, because I get paid, right, for being at those meetings. So should you. And so we host these meetings for people to get together and strategize together. And I think that's been really impactful for me, to be in a room of really great people who are like, hey, I want to see a difference in my community. And even with our steering committee meetings, I love leaving those meetings. I've always have learned something new, or I learned where I could be a better public health practitioner. So those are options. I think that we have over 10 meetings a year in different spaces. So I think it's just finding the space that you want to be in, and then we'll meet you halfway.
Absolutely. And talk about where not only you talked about your education and background, but to be in this field of public health and to be impactful, there has to be also a certain love and passion for community. So for you, where does that come from?
Yeah, I think like I said, I've always been a very empathetic person. I just really care about people, and like, I just can't imagine. I think a lot of times I think about, what if that was me? What if that was my family? What if that was, my grandmother, anyone? Like, I would want them to live as long as possible and as healthy as possible. And I think I did grow up with a lot of privilege, right? And I had friends who might have not had so much privilege. And just to see that we had two different paths, not because, right, it was by design, by like some laws, some like social laws that exist, right, that shouldn't have. And I think I've always realized that growing up, and not understanding, like, why do I have some things and my friend next to me might not have. And there's just something that just sat really wrong in my gut about that. Like, I don't know. I just think that I'm a really empathetic person, and I was at a job fair thing explaining my job, and somebody was like, how do you cope with wanting to save the world and you can't?
Hmm. It's a great question.
It is, right? And I think she wanted me to give her this answer that would really help her feel passionate. And I said, I go to therapy because it is a lot. Like, I think when you're in school and you're talking about public health, you're so excited about it. And then you get out in the real world and you realize kind of how sad the world is, right? You're seeing the data. I see data every single day, right? About either, this group of people is getting sick, or, like, this environmental change will impact all these people. And you want to save the world and you can't. But at least if I could save 5 people, that's a job well done to me. And I think that's why I do what I do. I'm never going to stop doing what I do. My grandma thinks what does she think? I'm a pharmacist. And so I try my job.
That's pretty cool.
She's like, well, I'm on this blood pressure medication. Grandma, I don't know nothing about blood pressure medication.
Oh, that's too good. Oh, that's funny. So, and you mentioned going to therapy, which is very important, and I love that more and more folks are just talking about the benefits of that. What are some other or another thing that you do just to make sure that you're taking care of yourself, like when you're doing this work with this passion and the level in which you're doing it? How do you pour back into yourself?
Hmm. I really think it's about finding spaces to have fun. Even within work, I'm so tired of following like a European style of work, right? Like, that is very structured. We go into a meeting, it has an agenda, we sit down. And I really think during work, it's finding spaces where I can just be myself. And I don't think that there's enough of that in a professional world. So I think I'm one of those people. I know a lot of people hate icebreakers, but I want to know what your favorite ice cream is, because I want to see you as a person. And I
Yeah.
think that I am trying so hard to create a culture of belonging at the health department because we all have to feel like we belong. And I feel like when you feel like you belong, it's easier to do your job. So that's something I do while I'm like at work is I'm very intentional with talking to people, with what meetings that I host. I don't want it to be very boring, sit down style. But at home, I know that we were talking prior to this, it's really being able to turn off. And that's so hard with public health because everything is public health.
Yes.
My partner will be like, oh, here we go again, because I drive by the same bus stop, which is a
Hmm.
sign in the grass, no shelter, no seats. It makes me mad, but it's just hard because everything you look at is public health. So I think it's just finding your hobbies. I tried to crochet. I'm not good at it, but it helps me get my mind off of work.
I feel you.
I'm a big reader. I play Sims, so if anybody likes to play Sims on the computer, I also do that. So I think it's just finding your space.
That's what's up. And then last thing, we'll put you on the hot seat. So then what does Alexandria go to? It's that one song in your playlist that's like it's in your forever rotation. And if it's one of those days where you're like you said, you run into that, you know, you need to recenter yourself and go back and just be you again. What's that one song that gets you going every single time?
Yes, and so I'm actually going to shout out Annika Moore for this because we had what is your theme song? Like, what is a song that empowers you? And she shared it, and it's been now a song that I'm like, yes, if I'm having a bad day
Hmm.
or if I'm like working out. So it's I'm Still Standing, and I'm pretty sure it's by Elton John, but I got to confirm because I don't want to be embarrassed.
I believe.
Yes, I think so too. So I again shout out to Annika because that song, yeah, by Elton John, it's definitely I'm still standing. I don't know. Some days are hard. Some days I might be kneeling, but at least I'm still standing. So that would be my
Wow. That's pretty cool. That's pretty cool. And if people want to be involved again, like I know you mentioned the site earlier, but if they just want to kind of, support the work that you're doing, what's that site again that they can kind of go to and really see all of the great things that are going on in the community?
Yes, it's MKE Elevate.gov. And on there, there's also a chance to subscribe to our monthly newsletter. So I'm not overbearing. I don't send a newsletter once a week. And those newsletter has funding opportunities. They have events. They have any of like our notes, meeting notes, anything like that. And if you or your organization has anything that you would like to highlight, send it my way. We will get it out. We really just want to uplift and highlight everything, all the great work all these organizations in Milwaukee are doing. So
Excellent.
mkelevate.
Thank you so much. And I know you've definitely helped bring this podcast to different eyes and ears that they wouldn't normally see it, so I really really appreciate that. So thank you so much for joining. It's been a super dope episode, and thank you all for listening, and remember, public health is dope and so are you. Peace.
Thank you.